Hello, everyone. Very nice to see you today. And we have very quick question and answers for CKD nutrition management. I have Dr. Aliaa El Ghamrawi. She is nephrology specialist. And I have also Dr. Mahmoud El Sheikh, is a nephrology consultant. Both are going to help us to answer and understand the take-home message from these questions. The first question is, what is the KDIGO 2024 clinical practice guideline recommendation for the daily sodium intake in patients with CKD? Is it less than 2 grams a day? Does the sodium intake shouldn't exceed 2 grams a day, or 5 grams a day, or should be less than 60 millimoles a day? Or does the sodium chloride intake should be less than 2 grams? Or does the sodium chloride intake should not exceed 3 grams? What do you guys think?
Okay, I think according to KDIGO guidelines 2024, they recommend restriction of sodium below 2 grams per day, which is equal to below 90 millimoles a day. In contrast to the potassium, which will be in the early stages, can be taken liberally, but the end stages or later stages will be restricted according to the GFR.
Do you agree, Aliaa?
Yes, I do agree, Dr. Mahmoud.
Nice, very nice. Thank you so much. Yes, so the correct answer is CKD patients should restrict their sodium intake to less than 2 grams. And here is the KDIGO recommendation. The level is 2C. And they, as you know, 2 is only suggestion, not even a recommendation. So they said, we suggest that sodium intake be less than 2 grams a day. And this is equal to 90 millimole of sodium and equal to 5 grams of sodium chloride. So remember, sodium chloride have 2 grams, each of 5 grams of sodium chloride have 2 grams of sodium because the rest is chloride. So each gram of sodium is equal to 45 millimole of sodium, and every 2.5 gram of sodium chloride, which is the salt, contains 1 gram of sodium. So the global average daily sodium intake, sadly, is almost more than double of this recommendation. So it's about 4.3 grams of sodium and 10.4 grams of salt. So that's very dangerous, and probably this is a reason of the high prevalence of hypertension and metabolic syndromes, obesity, in the general population. Large-scale RCTs quantifying benefits of restricted salt intake, like using 75% sodium and 25% potassium chloride salt to lower blood pressure and reduce cardiovascular complication in general population. Also, RCTs with a follow-up of about 9 months showed reduction of dietary sodium has been associated with lower blood pressure and the decreased level of albuminuria. So if you have a patient with high blood pressure, a patient with albuminuria, you need to restrict the sodium to less than 2 grams a day. However, to reduce the risk of CKD progression and cardiovascular complication, longer-term trials have not been conducted in CKD patients who need such long-term trial. Of course, it's hard to follow up these patients, especially no pharmaceutical industry will sponsor such studies. They, spend trillions of dollars on very expensive medicine, but when it comes to natural things like, the diet or the exercise or the healthy lifestyle, no one would like to sponsor this kind of non-pharmacological intervention. Given the effect of sodium restriction on blood pressure, it's reasonable to recommend sodium restriction to all CKD patients in combination with pharmacological strategies to reduce the risk of cardiovascular disease and the kidney progression. And people with CKD may have also salt wasting kidney disease. So this small percentage of patients who are losing salt and have malnutrition or expected to extremely live in hot climates. In such scenarios, this recommendation may not apply. So despite the vast majority of our CKD patients, this recommendation will apply, or try to be vigilant for those who live in very hot climate conditions or those with salt wasting kidney diseases. And again, here is a reference that was published in 2024 in the Kidney International Journal if you want to read more about diet control in CKD patients. Okay, who is going to read the next question?
Okay, I can.
Go ahead, please.
Which one of these statements is incorrect regarding the 2024 CKD diet instructions in CKD? A, adopt healthy and diverse diets with a higher consumption of plant-based foods compared to animal-based food. Advise to increase consumption of ultra-processed food. The probiotic nature of plant-based food may support the microbiome and reduce inflammation and uremic toxin production. Plant-based unprocessed proteins have been demonstrated to slow decline of GFR, reduce mortality, and improve quality of life. Do not restrict protein intake in children due to risk of growth impairment. I think the incorrect answer is definitely B, ultra-processed food is not recommended.
So much. Do you agree, Mahmoud, with that?
Yes, I totally agree with Aliaa. The correct answer is B.
Very nice. So, of course, this is a wrong answer because the consumption of processed and ultra-processed food is very dangerous to our health, to all the general population, and particularly those with CKD. So what is ultra-processed food? Ultra-processed food are these kind of food that we cannot usually make at home. So it's usually manufactured in the industries and formulated with a lot of additives, ingredients, and color adding and other non-natural recipes. These foods often undergo multiple stages of processing. This is hard to do it at home, and their ingredients may include flavoring and non-nutritive sweeteners as well. They are, very unhealthy for all of us, so we should try to avoid those. Examples of the ultra-processed food is soft drinks, of course, energy drinks, chips, cookies, noodles, Indomies, and processed meat like sausage, hot dog, nuggets, strips, sweetened cereals, candy, chocolates, ice creams, and frozen meats or desserts. So we should try to avoid those. Ultra-processed food have a very high salt, sugar, fat contents, and they are low in nutritional values. So they may promote inflammation and may contribute to the rapid progression of the chronic kidney disease. On the other hand, plant-based diet is rich in anti-inflammatory nutrients, fibers, phytates, and also it creates alkaline media, so it neutralizes the acidity in patients with CKD, and it has been shown to reduce the proteinuria and the metabolic acidosis and the progression of the kidney disease. Also, they have probiotics, so it improves the microbiome environment, and as we know that there is always gut-kidney crosstalks, so it improves this language and the conversation and the dialogue between the gut and the kidney. It also helps to reduce production of uremic toxins in the intestine and reduce inflammation. So the KDIGO guidelines recommend to use more plant-based diet, moderate the animal-based food, and dietary approach to stop hypertension, the DASH diet, which is rich in fruits, vegetables, greens, and is associated with low-fat dairy diets. That's also advocated, especially for those who have high blood pressure. The Mediterranean diet also is good because it's focusing on vegetables, fruits, fibers, nuts, herbs, grains, seafood, but also it contains a moderate amount of dairies, meat, and eggs. So, maybe the first part of vegetables and fruits is good, but we need also to moderate the animal part and the dairy products. Vegan and vegetarians are plant-based. The difference between vegan and vegetarian is vegetarian still can eat egg, can eat dairies and drink dairy products, but vegan, they don't eat any of those on top of vegetables. As they depend mainly on vegetables, so they try to avoid any meat or dairy products in these vegan patients. So it may help to slow down the progression of the kidney disease. However, they might be in very low protein diet that might affect their nutritional status, their muscle mass as well. The plant-based diet, low in animal-based and ultra-processed food, may be helpful to slow down the kidney disease, to delay the need for dialysis, and to decrease the cardiometabolic risk factors, decrease hypertension, improve diabetes and insulin resistance, decrease cardiovascular disease and obesity as well. And here is the reference. So let's do one more question. Who can read this last question?
Okay, I will go with that, Prof. Which one of these statements is incorrect regarding managing hyperkalemia in CKD according to 2024 CKD KDIGO guidelines? Instructor A, treating correctable factors like metabolic acidosis is pivotal. B, in early stages CKD, restriction of food naturally containing potassium such as fruits and vegetables may be harmful. C, advocate to limit the intake of foods rich in bioavailable potassium like processed food for CKD stage 3 to 5. D, the net bioavailable potassium from plant-based food may be lower than previously assumed. E, soaking food in boiled water have no role in reducing the potassium. I will go with Instructor E. Actually, this is one of the advices we give for our patients, CKD patients, to get rid of extra potassium from the diet, to soak the food in boiled water. Actually, this has an important role in reducing the potassium.
Very nice, very nice. Do you agree, Aliaa?
Yes, I totally agree with Dr. Mahmoud.
Very nice. So this is actually very correct because soaking food in boiled water is very helpful to get rid of a lot of potassium. And we talked in the first question about sodium and salt. And the second question, we talked about animal-based and plant-based diet. And here we are talking and emphasizing again about the role of plant-based diet and potassium, because especially early stages of CKD, the high intake of food naturally rich in potassium looks like protective against the disease progression, and dietary restriction of natural food like vegetables and fruits that has a lot of potassium may be harmful to cardiac health, and therefore restriction of potassium in these naturally containing potassium vegetables and fruits are not recommended. Provide advice to limit the intake of food rich in bioavailable potassium, like processed food. So we talked about processed food and the sodium part. Here we are talking about, again, processed and ultra-processed food. And the potassium part, especially in advanced CKD, because they are readily available, and the absorption and the bioavailability of this potassium is very high in the processed food, as I'm going to show you in a minute. So the net bioavailability of potassium from plant-based food may be lower than appreciated. So in the past, we used to ask our patients to limit their fruits and vegetables. We are not advocating for this anymore, except in patients with, of course, severe hyperkalemia and advanced CKD. Highly processed food rich in potassium additives, meats, dairy products, juice, and salt substitute made with potassium chloride are actually higher in absorbable potassium because they are very highly bioavailable and the absorption in the gut is very high. And we teach our patients that they should place a greater focus on highly processed versus unprocessed food restriction for hyperkalemia management. So we tell them don't go to fast food restaurants because they put a lot of preservatives. And of course, all the processed and ultra processed food, they put potassium as a way to preserve the food. So, and this potassium, even if the label on the food say it's a minimal amount, 10 millimole, but the bioavailability and the absorption of these are much higher compared to fresh vegetables and fresh fruits. Cooking methods such as soaking foods for just 5-10 minutes in previously boiled water. So you boil the vegetable in water, then you get rid of this water, can effectively reduce the potassium by about 50%. So that's a very, very good way to get rid of the extra potassium from the vegetables is to boil it for 5-10 minutes. Implement successful, affordable strategy for hyperkalemia that allows the maintenance of other therapies like RAS blockade and others. So instead of avoiding or decreasing the dose of the ACE or ARBs, just try to control the hyperkalemia with diet. So this will help to slow down the progression of CKD and decrease the macrovascular and microvascular complication. Here, what the KDIGO guidelines said, the first line management for patients with hyperkalemia is to review non-RAS inhibitor medication. So, stay away from the RAS. Don't always blame the RAS. Keep the RAS. Try to find other reason like NSAIDs, Bactrim, or trimethoprim, or other medications that can increase the potassium. Try to get rid of this. Then assess dietary potassium intake. Do dietary referral and consider appropriate moderation of dietary potassium intake. This is the first line therapy or intervention. Then the second is to consider use diuretics or bicarb, especially if the patient is acidotic, or licensed potassium exchange agent. And now we have a lot of them. But they are costly. So try to use, before using this expensive medications, try to use the first line, then try to use diuretics, like loop diuretic or thiazide diuretics. Then try to use bicarb in presence of acidosis. The third line is to reduce or to stop RAS or mineralocorticoid receptor agonists. So this is the last line. Don't go ahead from the beginning if the patient has hyperkalemia 5.6 or 5.7 to reduce the dose of RAS inhibitor or MRAs. No, you try to do the first line and second line first. Discontinuation of this medication, which are very helpful to our patient, might increase the risk of cardiovascular events. Review and restart RAS inhibitor and MRAs at a later date. So even if you have to stop because the potassium is whatever 6.5 or whatever, then you stop it for a week, then repeat the potassium. If the potassium is coming down, try to restart this medication because they are very helpful. Here is the last slide. So plant-based food, the absorption rate is about 50%, 50 to 60%. So plant-based food may have low absorption rate. They have net alkalinizing effect, so it decreases the potassium by alkalinization, as you know, because the intercellular shift of potassium. And also it has a laxative effect. So, when you eat a lot of meat or especially processed food, it can induce constipation, but, the plant-based food actually is kind of laxative. So it helps also to get rid of extra potassium. Here is animal-based food. The absorption is 70 to 90%. So it has higher absorption rate of potassium. And also it creates acidic environment, and this acidic environment will cause extracellular shift of potassium. And ultra-processed and processed foods absorption rate is the highest for potassium. It's up to 90%. So try to avoid those because these are the major causes of hyperkalemia in the current era because of the people who like to get the fast food and processed food. Thank you so much. And here is a reference again, if you would like to review, these materials and read more about the CKD progression and the diet control in CKD patients. Have a good rest of your day.
Thank you, Dr. Amr.
Thank you, Dr. Amr.